So you've tested positive for chlamydia or gonorrhea. Let's go over what that means. Let's start with what these infections are. Chlamydia and gonorrhea are bacterial infections that can be passed on through oral, vaginal, or anal sex. These infections are very common in people who are sexually active, and there's nothing wrong or shameful in testing positive. You took a great step for your health by being tested. What are some common symptoms for chlamydia and gonorrhea? Common symptoms can include abnormal discharge, burning sensation while urinating, pelvic discomfort, swollen testicles. It's also very common to have no symptoms. It just depends how our bodies react to the presence of these infections. How are these infections treated? Chlamydia and gonorrhea infections can be cured using the adequate antibiotic prescribed by a medical provider or doctor. What happens after I complete treatment? Your provider will talk to you about how long to abstain from sexual contact in order to prevent reinfection. This period of abstinence is usually very short and typically lasts about a week. A common question that we get is, how soon after completing treatment can I retest for chlamydia and gonorrhea? A test of cure, which is done after completing treatment for chlamydia and gonorrhea, is typically not recommended. In certain situations, a medical provider will recommend a test of cure, but if that's the case, your provider will walk you through and they will communicate that with you. At minimum, it's recommended to wait 6 weeks after completing treatment to retest. Retesting too soon could lead to a false positive. If your symptoms ever come back or don't improve, your next step should be to talk with your doctor and seeing what steps they would recommend. Telling a partner that you've tested positive for an STI can be scary. We always encourage open and honest conversations. Encourage your partner to get tested and always remember the window period. To have an accurate chlamydia and gonorrhea test result, it is always recommended to wait 2 weeks after a sexual encounter. Testing too soon might result in a false negative. Keep in mind, testing positive for an STI does not always mean that somebody has cheated or that your relationship is over. Your safety always comes first. If you're afraid that your partner might hurt you, you might be better off with a text, phone call, or email. You can also send your partner this video. Need a list of places to get treatment? Check out our description where you can find a link to various testing sites and places where you can get treatment throughout the state of Colorado.